The NHS is facing months of potential disruption after first-year resident doctors overwhelmingly voted to strike in a row over jobs.
Or no jobs. Whilst no dates for a walkout have been set, the British Medical Association says two-thirds of resident doctors, previously known as junior doctors, are left without a job at all after their speciality training. Joining us now, Dr. Arjan Singh from the British Medical Association. Very good morning to you. Just describe for us, what is the situation? So you've trained as a medic, you've done your university training, then you go on, and at what point are you where you find out there's too many of you to do the jobs which are available?
So after the 2 years of foundation training is where this bottleneck is primarily occurring. We are in a paradoxical situation where we don't have enough doctors, yet thousands of doctors are unemployed. You can see it in A&E waiting rooms where waiting times to see an emergency medicine doctor are hours long. Appointments for routine surgeries are years, not months, in terms of waiting lists. And compared to other countries, we are under-doctored, and that's due to successive failures of various governments in long-term workforce planning. But right now, 54% of doctors that are finishing their second year of training do not have a job. That is thousands of doctors that are out of work, that want to work, that we need to get to work to specialise as GPs and consultants to get waiting lists down. There's two reasons for this. The first, there has not been a meaningful expansion of training numbers for over a decade. And secondly, we have not been prioritising graduates from this country. We've been having applicants from overseas applying for a very small number of training jobs. Two-thirds of applicants are from doctors that have trained overseas. As a result, we have thousands and thousands of British doctors who are not in work at the moment, who are disenfranchised with working here at the moment and are going overseas and abroad. It is wasteful and it is immoral.
The government say they are in talks with you to sort this out. They say that you should be working with the government rather than opting for more damaging strikes. But your ballot, I mean, it's a ballot of first-year resident doctors. 97% voted to strike on a turnout of 65%. That is very, very strong support amongst first-year doctors for the position you're taking. Is your strategy to force the government's hand by actually going out on strike? Or are there things you now want the government to give you quickly so that you can avoid the disruption? What does the government have to do to call this strike off?
Firstly, there's no strike plan. There's no dates planned. We haven't called for any action. We're not planning to call for any action because I think the solution here is quite clear. We need to do two things. Number one, we need meaningful expansion of training numbers. So 5 years ago for psychiatry, there were 1,000 doctors applying for 500 psychiatry jobs. This year, there were 10,000 doctors applying for those same 500 jobs. That is not sufficient. That is not sustainable. So we need meaningful expansion of training numbers. That's number one. And number two, we do need to prioritise British trained graduates that have trained in world-class medical schools in this country and those who have already made significant contributions to the NHS. That is absolutely vital. Right now, we spend millions and millions of pounds funding medical school training in this country for doctors to then go overseas. And then we spend millions and millions of pounds recruiting doctors from countries with, lower income, poor countries with very fragile healthcare systems to come and work here. That is immoral. It is wasteful. It needs to stop. So it's those two things that we need. And if we get movement there, then we can take that to members and there will never have to be any sort of strike action. The government does agree with us. They agree we need to prioritise British graduates and those that have served it for a while. They agree that we need to expand training numbers. It's just the pace at which that is occurring needs to speed up.
Can you explain to our viewers, and indeed to us, why we import doctors when we do have homegrown trained doctors out of work?
I don't know. That's the honest answer. Now, there was a time, there has been for many, many years a shortage, and we still have a shortage of doctors across the NHS. That still happens now. And we've had doctors come from overseas, world-class doctors that have built and helped the NHS. So that there is no doubt. Let me clarify that for you now. In terms of specialty training, we have a cap. We don't have a huge number of positions. We've got 30,000 unique applicants applying for 10,000 specialty training places. 10,000 of those are graduates from UK medical schools. 20,000 are those from who have trained overseas and abroad. Our ask is quite simple. We've got phenomenal doctors here that have trained in world-class medical institutions. They need to be getting into specialty training so they can become GPs and consultants and help reduce that waiting list. Doctors want to work. Let me make that very clear. And those that have served here and have contributed significantly to the NHS, likewise. I think this is a very simple solution. We do agree with the government. I don't think any of your viewers will disagree on this. I think this is quite simple.
Can I ask you about how you felt as a BMA leader about the comments Wes Streeting made? It was actually at a BMA meeting with you a couple of weeks ago, I think at the Labour Party conference or around it, where he appeared to be drawing the BMA, drawing you personally, into a political fight. He said the NHS is hanging by a thread. I urged the BMA not to pull on it. He said if Labour's failed on the NHS and they will elect a reform government instead, a party that has openly said it will replace the NHS with an insurance-based system. He said if we fail and Nigel Farage gets his hand on it, then it's reform and die. I don't know about you, but I do not want that on my conscience. Are you comfortable with Wes Streeting challenging you to support him to stop a reform government ending the NHS, or do you think Wes Streeting's right?
No, I'm a doctor, I'm not a politician. We'll work with any government. There is one thing that he's right about, that is the NHS is hanging by a thread. 500 people in this country die needlessly every single week because we don't have enough doctors, because we are under-resourced. We're telling you right now, there are thousands of doctors out of work that want to work, that will put in long hours to help get the waiting list down. They just don't have a job at the moment. It's a paradoxical situation. So I can agree, the NHS is hanging by a thread. The other stuff is completely irrelevant, to be completely honest. We have a solution to this problem, this retention crisis that we have. It's training more doctors, getting more specialty training places in a sustainable manner, of course, so that we can get doctors to get people off waiting lists, back to work, and make this country more productive and ensure that medicine remains a sustainable and attractive career for students, for medical students, but also students that are in school right now.
Dr. Arjan Singh from the British Medical Association, thank you very much indeed. I'm sure a lot of people will think, please don't strike. It sounds like he's saying we don't want to strike. No. We voted for strike action. What he's done very effectively is revealed a problem within the NHS that many people won't realise is the problem. We always think of doctors as overworked, underpaid. But if the reason they're overworked is because there's lots of doctors sitting around going, well, I can't get a place, that becomes a very different thing, doesn't it?
That's right. I think when it strikes about pay at a time when cost of living has left everybody under pressure and when the NHS is really, really challenged with waiting times, that is more complicated for the BMA.
Yeah.
But on this one...
And patients probably less sympathetic, even though they understand the doctor's point. But on this...
Get more doctors into jobs. Come on, Wes Streeting and Stephen Kinnock, get on with it. They've got a mandate to strike, but they don't want to, and they want a deal, and so does everybody else.
Yeah, Stephen Kinnock says training bottlenecks are a very real issue and the government's working on a range of measures to tackle them.